You can sit or you may have to stand side towards me a little bit. There you go. That's good. So we're going to take this arm and we're going to flex, abduct, externally rotate as far as you can go. You're not loose through your shoulders. Gumby is a cartoon character that was made of plastic and was super flexible.
And green.
That's what I was talking about, and green. Yes.
Pretty flexible.
He's pretty flexible. There's not really much stopping me here. So I have to stabilize the scapula. So you're on the inferior angle of the scapula from this axillary border. I use kind of a C grip. You're coming in this way. Like that. Get a hold of that inferior angle and hold that scap tight in against the body. And he's got nothing. No stretch, huh? No, nothing.
Now, would you, like,
Yeah.
to get a good stretch, though, would you, like, set them up and then have it stretch behind their head or anything like that?
You can, and then stabilize. It's a little harder to stabilize the scap if you
Okay.
have them sitting up. It's a little easier when their weight is on the scapula
Okay.
to be able to hold that inferior angle in. He's just really, really mobile. He doesn't need that stretch to happen. Somebody's tighter through the shoulders.
Matt?
Come up here.
Matt,
Ejected.
you got ejected.
He gets in pain.
You know, and you cannot, and it's true, Tony will be tighter. You cannot have muscle development without having some tightness and shortness in some of these muscles. That's what happens as they hypertrophy, is they will assume a shorter position than normal. And especially if you lift and don't stretch a lot, they will get a little tight. Although your shoulders you're fairly back, you know, you're not real rounded. So you must stretch a little.
I'm not doing a lot
No.
of antagonistic muscles.
So again, here, get to that scap, push it in.
Want me to put the brakes on in your chair?
Not real tight either. That's not bad. Going a little stretch.
Mm-hmm. Yeah.
Okay. If I really needed to get in there, I can come this way.
Yeah, I feel it.
And somebody who's really tight in their lats, and you'll have them like here, and be pushing and have some resistance at this point. So that's not bad. You probably felt more right there. Okay. All right, go ahead and sit up. And sit kind of at the edge of the table for me with your legs over the edge. That's good. That's good. Come back towards me a little more. All right, now we're going to stretch them across the trunk. Before I just stretch them across the shoulder, now we're going to do them at the origin. So you're still going to bring that arm like this, okay? But you're going to put your hand on, and you can use either one, put your hand on the iliac crest, hold that iliac crest down, and then you're going to kind of side that down. You feeling that? And he's going to feel that more through here, more into the body of the muscle versus up here at the insertion. Okay, this again is more for somebody who has some low back, usually low back pain,